Welcome to Back of the Box. My name is Ben. I am joined here with Taylor, my beautiful mustached coworker. Um, today we had an idea. Taylor had an idea rather of talking about being a healthcare provider, being a patient as a healthcare provider, and then being a provider for a patient that is a healthcare provider. Because it's always, not always, but it can be a very touchy situation, I think is the right word to probably use for that.
Intimidating, maybe.
Intimidating.
Yeah.
Overbearing, I think is another good word to use. I think I get a lot more of that where I work and like with primaries and the pediatrics and whatnot, because the parents who are providers can be a little bit more overbearing at times. Sometimes they're great. But I'll let you take over, Taylor, because you have a story that kind of led you into this topic.
Yeah. I just kind of had a lot of time to think over the past little bit, with being off work for a little while, but long and the short of it is I was in a relatively moderate to higher speed motorcycle accident, where I had to lay down my bike. Someone pulled out in front of me, kind of a typical story that the driver just didn't see me, and ended up with what turned out to be significant injury when at first we kind of thought it was nothing. And as I kind of laid in the emergency room, I kind of felt bad for the poor EMT that took care of me. She did great. Don't get me wrong. She was really fantastic. And the crew that responded to me was awesome. But when I was actually on my way to the school, so I had my instructor uniform and all that. And you could kind of tell that there was a hesitancy when she found out that she was taking care of one of her own. And so I thought it was a good kind of talking point to talk about, especially for our newer providers out there. Or me and you, and especially in the emergency room, we get such high volume of patients that we do deal with a lot of people who are in the healthcare field and they can be your best patient or your worst patient of the day, depending on, the behavior and the interactions. But I guess my biggest takeaway from this whole event, um, was me being stubborn and pretty defiant and didn't want treatment, kept saying I was okay. Not in a rude way. I just, I'm fine. I'm fine. I'm okay. Thank you for coming, guys. But, I'm okay. And had I maybe even pushed more, I might have not even let this poor EMT not do an assessment because I felt I was fine. But after, the better judgment got to me and I let her do the assessment, and we actually found some pretty significant injuries. So it's not just because we work in the field, we don't always know best, especially when it's involving us or a family member, because then we're involved in the call, right? Like we're part of it. We're no longer, we're still advocates for our own care, but that's why we don't really like to respond to family members, to friends, because we have, some extra skin in the game, I guess you could say, for some reason.
Well, especially if you're looking at like from a friendship level or a family level, right? Like that, I think in its own course changes your mind thought process.
Yeah. Clouds your judgment.
Right. You're no longer thinking as rationally as you should, and you can't necessarily make those hard decisions as easily or as rationally as you should, because you're thinking with your heart more than you are with your actual mind.
Yeah.
And so that changes the game immensely, I think, for so many people.
Yeah. Yeah, it clouds your judgment. Um, and so, and I even myself, if I was taking care of a 20-year, critical care fire medic, it'd be intimidating for sure. Um, and we're all type A personalities and want to do that. And so it's kind of twofold of, again, nothing against this EMT at all. And it was great care and took care of me. And she did push for full assessment or full transport. Um, and kudos to her for doing that because I was pretty stubborn with it. Um, but I think, I think back and like, would I have let one of my patients tell me what to do to that degree on a call? And it's no, I wouldn't. And so, as providers, we shouldn't expect other care providers to treat us any differently.
It's different when, in the heat of the moment too, right?
For
Is after that happens, right? Especially in situations like that, which are very high adrenaline, high intensity. Um, you're not thinking straight in your own mind, right? You're not aware of your own injuries at that point in time, especially with your injuries being luckily less severe than they definitely could have been, right?
Yeah, for sure.
For the large most part of it is you walked away with quite a bit of road rash, um, and you didn't even find out about other injuries until a week later.
Yeah.
Um, but in the heat of the moment, you don't even know to what extent your road rash is, right?
Yeah.
And I think there's an air of almost embarrassment to some degree, I think is the right way of putting it.
Yeah,
If you're a provider and you're having to call 911, right?
Yeah.
Um, regardless of whether you need it or not, like, and it's an embarrassment thing, but also like I think in the back of your head, you're like, I'm fine. You guys would be better off somewhere else, helping somebody else.
Yeah.
Um, don't waste these resources on me. I'm just fine, right?
Right.
When arguably you're not. I think that's another big aspect of that as well. Um, but then there's I think so much more to it in terms of just for such a large community now of healthcare workers, firefighters, police officers, nurses. It's very tight knit,
It is.
and things and information spreads so quickly.
So quickly.
And so there's that. I think that fear as well of like, are they going to find something out, regardless of their anything to actually be found out about? But who's going to know about this tomorrow or the next day or in a week?
Yeah.
You know what I mean?
Yeah. And that's something to tell, all of us that even in high stress situations and that we are held to a higher standard.
Yeah.
And we should act appropriately because we've seen where they have it. But it also kind of, and brings up the topic of, releases on scene. And that's a whole nother kind of topic in itself. And not in, I'm just using it as a jumping off point, not criticize or talk, that of what my story, but I know it's definitely pretty, we always have pretty deep conversations in classes for students of, well, when can you and when can't you? And, to my old partner's credit, I used to have a partner who really, no matter what the call was, he hated doing, refusals or releases on scene. Everything he could do to avoid them. And as kind of getting a few years under under me. At first it kind of was like, do they really need to go? Like, on a whole nother trip and that. But, um, as I've gotten more experience and more wisdom, I've learned that, yeah, like a lot of patients check those two boxes of are they alert and oriented and can they, understand the refusal? But there's also that complex underlayer of, well, you're going to have to live with, if something happens to this patient down the road, that,
Yeah.
that you find out about or you get called back to and that. And so, uh,
But I think in the same point with that premise, right? There's an air of if they can check the boxes, they're alert and oriented, they're educated, and they have the right to sign AMA to refuse care. If something else were to happen to them down the line, like as long as you are confident in them checking those boxes, like you gotta give yourself some grace in terms of if you did everything you can and you tried to talk them into going, great.
for sure.
Um,
Right.
right. Um, and that's also why, like, when I was in the field, like, I would never talk anybody into not going. Like, if they wanted to go, then we were going,
Yeah.
right?
Oh, for sure.
Because that's a lot harder for me to do. And if in that same situation, if I talk them into signing AMA, because I didn't think they needed to go, and then something were to happen later down, right? Because then
Right.
that was me convincing them,
Right.
right?
Right.
But if they're in agreement, they don't really want to go, and I agree with that, you know, regardless of my own thought process or anything else, like there's only so much that we can do, right?
For sure. And
I used to also always judge that off of like looking at, because out by the resorts when I was on ski patrol and things, you get a lot of like, and you get the same, I'm sure, a lot of like private vehicle, broken legs,
yeah,
oh, we'll just drive ourselves, it's your son or whatever the case might be. I always judge that on how hard I would push on how much I thought you were actually going to go get care,
yeah,
right? If you had a game plan, you told me, yeah, we're going to go right now. We'll drive down. We'll go to this clinic. I'm like, great, go.
right.
But if they were like hemming and hawing, going, oh yeah, we'll get care and we'll get it checked out, and later today or tomorrow maybe. And I'm
Yeah.
like, no, like this needs to, like now I'm pushing for transport more so because I don't have faith that this dad or this husband or whoever is going to actually have appropriate follow up care.
Yes. Yeah. And yeah, we're not responsible for just because we get called to them once, we're not responsible for their entire health care for the rest of their life
No,
or anything or rest of the day, but more so to the providers out there. And we've all seen them where as soon as they walk up and the patient says, I don't want to go. And they go, oh, okay, yep, sign here. And it's like, yeah, they told me their name. They told me that, and that's good enough. Make sure you do a full assessment. Make sure you do check your boxes. Make sure you do it. And for example, the same pair, and I guess why this really is a spot for me is the same partner. I mean, he kind of saved my butt on a call because, as you know, where I work, in the wintertime, we get slammed. It's ski
yeah,
transports, resorts are slammed. We're doing multiple calls. We're stacking up reports. And I got complacent myself. And we go to a call and it was a ski injury. It was relatively, appeared to be mild. And this gal walked up and started talking to her. She was able to answer all my questions and that. She just reported that her head kind of hurt. And I thought, okay, I checked my box. She can do that. She can refuse care and that. And I said, hold on, let's make sure we do a full assessment. And as we did it, we're like, oh, you know what? And we were able to kind of say, we can't force you. We don't ever want to force a patient to go seek care, but
yeah,
all right. She ended up agreeing. She said it'd probably be easier if you guys took me, and we took her. And she actually ended up having a pretty severe head injury where she did actually decline during transport. And it was a real like, oh man, I really messed up on that one. I could have just let her
yeah,
go. And so releases are fine and treat, refusals are fine. People are free to make that decision, but make sure you do that little extra step beyond just saying, oh yeah, they're alert and oriented and they can tell me their name and where they are and what happened.
And they're telling you that nothing hurts, so they're fine.
Yeah, like look into it a little bit. I mean, you're there
Yeah,
already. You already took the call. Like you're already out there. Like it
that's
it, it can save you.
yeah, that's something that we get asked a lot in our classes of, well, like if you show up on scene and they have an obvious deformity to the lower leg, and that's all they're complaining about, and they're, GCS 15 and all the other stuff, do I really need to do a full head to toe assessment? Like, is somebody really going to let you do that to them when they're alert and conscious and awake? And like, the answer is yes,
Yeah,
right? The answer is most of the time, they're going to let you do whatever it is you deem necessary, as long as you're communicating with them and explaining them and educating them as you go, right?
yeah, yeah,
Where, and just in that same situation, that's where it saved your butt.
yeah,
Kind of going back to me being on patrol, because that was like, we'd see very frequent, knee injuries, leg injuries, wrist injuries. And every single time I would go on those calls, I would do a head, neck, and back check,
yeah,
right? I don't care, regardless of what happened, whether you hit your head or not. Let's just make sure that if I get hands on and all of a sudden I find pinpoint tenderness somewhere or a step off or something else, then that changes things a lot, right? But if I just take you at your word and go, yeah, my wrist hurts and that's it, then I'm not going to find that other injury that has now just gotten worse because now we've skied down the hill together, or we didn't take spawn precautions when we should have, or any number of things, right? Um, so doing the full head to toe, I think, is extremely important. And just doing a full assessment on every patient, regardless of what they want, right? And it's one of those things where I feel like using your words and more experience you have and talking to them, and even patients who are refusing care, if you say, that's awesome, you can do that, that's within your right, but first I have to do this,
hmm,
right?
yeah,
And you can kind of going, yeah, we can do that after I do this. Let me check you out. And if there's nothing wrong, if we find nothing wrong, then we'll let you go.
yeah.
Right.
That's where the
Well,
human part of our job comes in, and not coming in as authoritarian. And, you know, uh, usually with those kind of patients I know need to go and get treatment, sitting down, talking to them for a minute, not about the actual medical problem, but the reasons why they don't want to go. There could be multiple financial, um,
yeah.
past traumas, anything like that, to where they don't want to go to the hospital. And so one thing I would like to do is, for one, I find somewhere to kind of either sit or kneel next to the patient instead of the constant standing over the patient and overbearing and listen to me kind of, posturing, but sit down and say, like, something scared you enough to the point where we got called, you called us, your family member called us. Um, to be honest, if you were one of my family members and you called me, come look at you, we would be going to the hospital right now. And that's my standard of care. If this was my sister, my brother, my dad, my mom, whoever calling, because we all know once you enter healthcare, you kind of become the family care provider to some degree.
Yeah.
You know, if you were my family member, yeah, we'd be going right now. We'd be getting looked at, and so I think that can really elevate your level of care for these patients.
Well, 100%. 100%. And I feel like that also, when they hear you say that, I think that in a way makes them kind of realize, oh, like, okay, this is more serious. Like, if they're going to go do this with their family, then this is something I should probably really actually do.
Yeah,
Right.
yeah. And we don't get commission, we don't get money or any kind of kickback for how many
Could you,
transport.
could you imagine? Could you imagine if we got commission on transports?
Oh man,
God.
it would be awesome. No. Oh, I would be jumping calls left and right, but yeah, we're just out there to try and take care of our citizens, and make sure they're getting access to the healthcare that they need. And so, but
Yeah.
yeah, it's just, it is very different being on that side of the stretcher. Um,
We've all been there.
yeah, to some degree, if we like it or not. And
I wasn't awake during mine, but
I probably would have preferred not to, and knowing that they wanted to, and I did sign a refusal in that, but they're like, yeah, with all these qualifiers, you qualify as a trauma, and I'm like, I'm not getting wheeled into that bay and getting all that stuff done to me. Um, I just
no
oh
trauma handshake for me,
no,
thank you.
yeah, no, none of that for me, and then that's maybe uh a downfall of being in healthcare. You kind of know what's coming.
Because we know, yeah, we know all the ins and the outs.
Yeah. So, but yeah,
I remember coming in and out of my accident, my car crash back in 2015, and just the snippets that I remember were just the crew freaking out because it was the same city that my dad worked for,
oh yeah,
and they realized who I was, and I think having the son of one of their captains almost was more stressful than treating their own captain,
oh
right?
sure,
Or
yeah.
in that same situation.
Especially when your
Uh,
coworker's kid. Yeah,
yeah, yeah. And I think that put far more stress on them than anything else.
yeah,
But got great care, came out just fine.
yeah.
So,
I
um, so being having being a new provider, right? Inevitably, when you're going to handle firefighters or EMTs or nurses or doctors, and you're going to have them either as patients or as family members of patients. What are your golden rules or rules of wisdom? Words of wisdom for these up and coming EMTs, firefighters, nurses, whatever it might be, in handling those situations. How to just kind of go about it, I guess.
um, and this is definitely one of those easier said than done type of situations. Um, where I just treat everyone to the same level of care. I treat everyone with the same level of respect, whether it, an intox or my captain's son. Um, there's definitely that, and I try to befriend all of my patients and remain professional and keep it that standard. That way there's nothing ever held against you, or it's just, this is what I do for everybody and this is how I treat it. Um, and then, if you're getting a lot of pushback from a medical provider, use that card a little bit of look, you understand, you take care of patients as well. I have a job to do. Um, I'm, I'm trying to keep to the same standard for everybody. I can't treat anyone special, same as I'd expect from you to treat your patients, and kind of talking that way. And especially, input and that from all sorts of, maybe a physician or that. It's always, like we always want help.
Yeah.
We always want input. We don't want it to the point where it is hindering our care or hindering our job, making things harder to do. If it gets to that point, then we have to have a conversation of, look, you want me to do what's best for your family member or for that. Give me a moment. I hear you. I hear what you're trying to say. I'm just trying to do what we're supposed to do. There's procedures and standard protocols for what we do, and there's a reason for them. And I hope you can appreciate that to that level. And just having that conversation.
Yeah, I think time helps as well, right? You're as a new found EMT or whatever you want to put yourself as, like there's an air of um, nervousness and pucker factor and lack of confidence that only ever goes away with exposure and time,
Yeah.
right?
Yeah.
And you're gonna deal with disgruntled people left and right, whether they're providers or not providers, whether they're just patients in general.
Yeah.
Um, at the end of the day, I kind of like what you're saying is to just follow your protocols. You know what you know, right?
Yeah.
And don't let them bully you around into something just because they say they're holding a higher licensure than you are,
Mm-hmm.
or anything along those lines, right?
Yeah.
And I think that's the big thing is, stand your ground. You know what you know. They called you, and it's at the end of the day your scene. And they can refuse care, they can do whatever they want to do, but they don't get to make the decisions in terms of dosages and what medications they want or don't want or whatever the case might be.
Yeah.
Right.
Yeah.
Because it's not up to them.
And, and how you present yourself and being prepared for this and knowing your protocols are going to help you. Cause I find the biggest thing is when you don't really know what you're doing and then someone gives you pushback and you're kind of doing that him and ha. But if you can say, no, this is my protocol. This is what I'm supposed to do. This is my standard of care. You can have a little bit more footing on that. And we're not trying to be confrontational by any means. It's just, I understand where you're coming from. And maybe we work in different settings. When we get to the hospital, we can definitely talk about that and talk about that treatment. But this is what EMS is, and this is what we do. We work by kind of
we have
different book. So,
yeah. You mentioned how you present yourself, and that actually like triggered we had this conversation Tuesday night in class with the students of how you present yourself is for all patients goes a long way.
mm-hmm.
Right. Going in and being clean and having your hair done and, upholding whatever grooming policies your agency has. Like I would never go into work with my cheek lines not, trimmed down and these kinds of situations and looking presentable and being in the uniform and wearing it correctly, I think also goes a long way. And if you show up, especially if you show up to another provider's house or something and you're looking disheveled, regardless of what time it is, I don't care if it's 3:00 in the morning or 3:00 in the afternoon, right? You got to figure out a system that when you roll out of bed at 3 a.m., you're going to these calls and you're looking presentable, right?
Absolutely.
So throw your ball cap on, put your coveralls on, or whatever it is your agency lets you do, and look presentable, because that's going to go a long way in terms of gaining their respect and their trust. And if you look like you know what you're doing and you look like you're a professional, then there's going to be that air of assumption.
Mm-hmm.
And you're not having to build the trust up because you look disheveled. So they're going to look at you and go, well, you obviously don't know anything. And having to build that, you're going to start much higher with them just in how you present yourself overall.
Yeah. And that starts, your uniform, your apparatus, your stretcher, having it all look nice like that. There's a saying where I work, it's kind of lame, but I feel like it's very valid, is the most important thing about a uniform is uniformity. And so if you got some guys looking like crap and some guys are wearing their t-shirt, some are wearing, they're snappy, some are wearing coveralls. You know, it just kind of looks like you're disheveled. You're not a team. You're not presenting. And so talking to your
Yeah.
crews and making sure that you guys get on the same page and you just look dialed. It's a big
Yeah.
part of what we do.
Yeah, it's always interesting to see the crews walk into the hospital. You've got like one of them is in their button down, Class B shirt. One's in their turnout bunker bottoms. You're just like,
Yeah. What's going
what was
on?
going on here? When you guys like, and I get it. I full on get it. Like if you're
Yeah.
in the middle of a gym session and you get
Mhm.
a page out and it's something, especially something serious,
Yeah.
you're just running and you're putting your bunker bottoms on. You're going right.
Yeah. Mhm.
And like and everyone's different. Like my dad, especially the tail end of his career, was like always in his Class B. That's just what he wore.
Um,
Um, and so everyone's slightly different. And I know that there are chiefs out there and captains out there that's what they want.
mhm.
So I agree with you on that. Just uniformity, and if you can go and as a crew and show up and there can be slip ups. Everyone's gonna have that time when they show up in their Crocs or their station suit shoes or whatever the case might be. And address it and fix it and apologize to your patients for it and move on from there.
Yeah.
But
Next time we see Mick, we should ask him about wearing Crocs to a call. I think he's done it a few times.
oh, I'm sure he has.
Yeah, or he's jumped in and gotten going, and he's on scene
Yeah.
trying to switch into his bunkers.
No, like I said, I think everyone. I think Nick's done it. My dad did it once or twice. He's told me. Barrett did it. Wore his skater shoes to a call accidentally once, and
We all do
happens
it.
to the best of us, and it is what it is, and you live and you learn.
Yeah.
But no, I think that was good, and I think the end of this, I think the thing to also remember is that as you become a provider, or if you are a current provider, and you're going to the hospital or you're calling 911, let them do their job. Yeah. Right. Be involved, obviously. Don't, if you notice something that is wonky, don't just, lay back and let them do whatever the hell they want.
Yeah.
But you called them, so let them do their job. Have some humility and, take a back seat this time. Be a patient. Especially if you're calling 911.
Absolutely.
Right? So.
Absolutely.
But.
Well, good.
No, I think that was
I
good.
hope that was beneficial and some, good talking point.
No, I think it was great. So thanks for joining in, everybody. We'll be back hopefully within the next few days on another episode. But we are now on YouTube as well. So Back of the Box podcast on YouTube and Spotify. You can find the video podcasts. You can find the shorts. And I'm working on getting us on iTunes and some other things going. We're also on Instagram, so you'll get notifications there as well. So give us a follow, a subscribe, do whatever the days you're going to do, whatever platform you're on, and let us know what you think and what you want to hear, and we'll keep this ball rolling. But thanks, Taylor, for joining me, and until next time, guys.
Till next time.